Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a patient talking to a pharmacy assistant. Now read the question.
Hi, I need to refill my prescription, please.
Of course. Can I have your name and the medication you need refilled?
It's Stephen Thompson, and the medication is for my blood pressure.
Let me check. It looks like your usual medication is lisinopril. Do you need it urgently?
Yes, I'm almost out. I'm worried about missing a dose.
I understand. Unfortunately, we're currently out of lisinopril, but we can have it ready for you tomorrow morning. We do have an alternative, though, enalapril, which works similarly.
I'd prefer to stick with lisinopril since it's been working well for me. But do you think I'll be okay missing a dose tonight?
It's important to stay consistent, but missing one dose shouldn't cause immediate issues. Still, I recommend getting the refill tomorrow.
Okay, I'll come back in the morning.
Now look at question 26. You hear a medical professional explaining hand hygiene protocols. Now read the question.
You'll have seen the announcement about the new hand hygiene protocols that are being introduced next month. I'm sure you've considered how these changes might affect your routines, and it's completely understandable to have questions. There's no doubt that stricter hand hygiene practices can significantly reduce infection rates, which is why these updates are essential, but I recognize that implementing new procedures can seem overwhelming, especially with your already demanding workload. I want to reassure you that we've carefully designed the protocols to integrate seamlessly into your existing workflows. We'll be providing comprehensive training sessions to ensure everyone is familiar with the new steps, and we've placed additional hand sanitizing stations throughout the facility to make compliance as easy as possible. Supervisors will be closely monitoring the implementation to ensure that it doesn't interfere with your duties, allowing you to maintain your focus on patient care without added stress.
Now look at question 27. You hear a nurse talking to a colleague about a patient. Now read the question.
Today, we're going to focus on Mr. Thompson. He's 1 week post-surgery after having a pacemaker implanted. There was some mild swelling around the insertion site, but that's to be expected. This is his first follow-up since the surgery, right?
Yes, that's correct.
Okay, so today, we're going to start with gentle massage therapy around the incision area to help reduce the swelling and promote circulation. This should aid in the healing process and decrease any discomfort he might be feeling. We'll also monitor the site for any signs of infection. Over the next few sessions, you'll see how the treatment progresses to ensure proper healing and to prevent complications. The main objective is to manage the post-operative symptoms and support his overall recovery, allowing the pacemaker to function effectively without causing unnecessary strain on his heart or surrounding tissues.
Now look at question 28. You hear a physician talking to a nurse about Mr. Roberts. Now read the question.
It seems that Mr. Roberts is still a bit dizzy after his endoscopy. Is he showing any other symptoms?
Just some mild nausea, which is improving. I'm going to check his blood pressure before he's moved to the ward.
Good. I've placed additional orders for his post-op care. He has a history of heart disease, so we need to monitor him closely. There's a risk of arrhythmia due to the sedatives used during the procedure. I want his heart rate and rhythm checked every 4 hours. Also, keep an eye out for any signs of chest pain or shortness of breath.
Got it. I'll make sure the next team knows to monitor him for any cardiovascular issues.
Excellent. If you notice any irregularities or if his condition worsens, call me right away.
I'll be on alert.
Now look at question 29. You hear a nurse talking to a patient. Now read the question.
How are you doing today, Mr. Harris?
A little tired, but much better. The bandage feels snug, but there's no pain, so that's a relief.
That's good to hear. We've made sure the wound is clean and dressed properly. The stitches should heal nicely, but you'll need to come back in a week for a follow-up.
Thanks. I'm still amazed that I could get the stitches done so quickly. I remember when I had a similar cut a few years ago, I had to wait hours before getting treated.
Yes, advancements in triage and treatment have really improved wait times. Just make sure to keep the area dry and avoid heavy lifting until it heals.
I will. It's just surprising how efficient everything was this time. I was expecting a longer stay.
It's all about getting you back on your feet as quickly as possible.
Now look at question 30. You hear a physiotherapist talking to a group of patients about the importance of physical activity. Now, read the question.
It's essential to recognize that regular physical activity plays a pivotal role in recovery. It's not just about regaining strength, but also about improving flexibility, balance, and overall function. Unfortunately, some patients are hesitant to engage in exercises, fearing that it might worsen their condition. However, studies have shown that inactivity can actually delay recovery and increase the risk of complications, such as muscle atrophy or joint stiffness. Our clinic has seen a significant improvement in patient outcomes by encouraging consistent, tailored exercise routines. In fact, our recovery rates are above average, with 90% of our patients achieving their mobility goals, compared to around 75% nationally. To sustain these outcomes, we need to emphasize the importance of staying active, even when progress feels slow. The key is to start gently and gradually increase the intensity under professional guidance.